This is great. Thanks for coming out, everyone. I do want to just quickly touch on three things. One would be COVID. Two would be the health tour we've been on across the province. And three would be an announcement around virtual care. So, but first, before anything, I mean, obviously, we lost a Nova Scotian today. Sincere condolences to the family, to the community on that for sure. That's a terrible tragedy. And our COVID numbers are creeping up. We all know about that. I feel the same anxiety that the community feels, and we'll certainly be working closely with Dr. Strang to do whatever's necessary to keep Nova Scotians safe. That's on COVID. It is certainly something that's on the minds of most Nova Scotians. So I'm sure we'll have some discussion about that. But the tour over the last 4 days, I guess, it's been, I feel actually a real sense of optimism. I feel that because as significant as the challenges are, and they are significant, we have such dedicated people, and I've had the chance to look many of them in the eye, hear very first-hand accounts of some of the challenges that they're facing. We've had some frank discussions, but through it all, they are still getting up and going to work every single day to deliver care to Nova Scotians, and I am very, very encouraged by that. And there's lots of things that we're learning that we can. There's action items, and they seem to feel encouraged and hopeful because they've seen that we are a government of action. So it's been an incredible investment of our time over the last 4 days, and I think the feedback I've received from healthcare professionals is that they've also felt it's been a good investment of time. So what will really determine is where we go from here in this next week. So happy to take questions on the tour. But the third thing I want to talk to you about today is we have an incredible amount of unattached Nova Scotians. I think the list is somewhere in the range of 75,000 Nova Scotians that don't have access to primary care. I feel their anxiety, I feel their concern, their frustration. We know the impact that is also having on our healthcare system as people turn up at emergency rooms for what would normally be primary care issues. So today we're moving forward with one of our campaign initiatives, which was that every unattached Nova Scotian will have access to virtual care, and that access is something we're urgently trying to organize, but we're working with the provider, and that access should open up in December. So it's on the way. Virtual care is not for everything, but it certainly can play a significant role in the delivery of healthcare, particularly to those that are unattached and have nowhere else to turn at the moment. So we'll be moving forward with virtual care, and that's on the horizon. It's not as quick as I want, but it'll be here relatively quickly to support those Nova Scotians that are unattached. So happy to take any questions.
On virtual care, so far it's been in place in 2 zones since May, but there's only 8 family doctors and 3 nurse practitioners. What are you going to do to get more primary care providers signed up to give virtual care?
Yeah, so that's a pilot project that's happening. What we're doing is actually extending that program. So we're continuing on with the same type of structure, the same infrastructure. And the question is, who's going to be on the other end when somebody reaches out? So that's part of the reason that it won't start until December. The providers recruiting, family doctors, also nurse practitioners and other allied healthcare professionals. So that's part of the time lag is the recruitment, but it will be staffed by Nova Scotian providers. And the commitment is that it won't take away from the service that's already being provided by those providers. So
do you need to pay them more? Like, what do you need to do to incentivize people to provide virtual care? That's where I don't quite understand why more people haven't already signed up to get it.
Yeah, I think when you look at, and there's our healthcare professionals across the board are feeling overwhelmed in many situations. So I think it's just, compensation is part of somebody's quality of life calculation and their job enjoyment calculation, but it's not the only. So I think what we'll see is the compensation that goes to those that are providing virtual care in addition will be part of it. That's some of the discussions that are taking place now. But I believe, from my discussions with healthcare providers, particularly over the last 4 days, but certainly over the last years really, is they all want to do more. Like, they all see their colleagues drowning, was a word that's been used a few times. So they all are willing to do a little bit more to provide patient care. So I'm encouraged by what I've heard over the last few days, and that encouragement is part of the reason that I'm so optimistic that the virtual care can provide care to many of those unattached Nova Scotians and take stress off the system in other places.
And how many sessions have you held over the last few days?
The way we've structured it is we've had 2 teams. So myself and Dr. Oral have been kind of leads on one team, and the minister and the health authority CEO have been on the other. So I personally kind of lost track, but somewhere around 4 a day, I guess. There's one more tonight, another roundtable tonight, so somewhere in the range of 15, 16 sessions around the province. They've been very well attended. And actually, one of the interesting things that I've seen is people in the last couple of days have been coming because one of their colleagues from another area said it's worthwhile to go. So there's been buy-in from the healthcare professionals, and I think they've probably reached a point where they're just ready to speak frankly. They want to know that change is coming, and my commitment to them remains the same. It remains stronger now than it was even during the campaign. It was strong during the campaign, but after looking healthcare professionals in the eyes over these 4 days of the very, very intense sessions, I want them to know that I will give everything I have. My government will give everything we have to support them in providing care to Nova Scotians.
So what are they
How
saying?
would you describe the 3 months virtual care that you're offering? Because it's only going to last 3 months.
No, we're doing it now. Like, it's going to start in 3 months. It's going to start roughly in 3 months, but this is like, we want people to have access to primary health care. We want people to have the option to go and see their primary health care provider in person, because virtual care is not for everything. So we have to get to a place where that is the reality in this province. If you want to go see your primary health care provider, you can. We are very far away from that right now for at least 75,000 Nova Scotians, and I am concerned that list is growing. I hear lots of stories about primary care providers that are still contemplating leaving. So that access will start in December-ish, some point in December, as quickly as we can though, really, and it will continue until the healthcare system in this province is rebuilt, because that's really what needs to happen. It needs to be rebuilt in many ways.
Do you have an
What
idea of
are
how
you
long?
hearing from healthcare workers?
What I'm hearing from healthcare workers is that they are dedicated to their patients. A lot of concern about the patient experience, and hearing that from healthcare providers, that's number one on their mind. But the overriding thing is they feel overwhelmed. You know, it's been described a number of times to me over the last few days about healthcare professionals that talk about before, as they're preparing for their shift, sometimes even the day before, when they know they're going back on shift, their anxiety level starts to raise. Their own mental health is suffering. Their anxiety level is raising quickly, because they just know that when they get to work, they're going to be short-staffed. They're going to be overrun. And they are concerned that they can't provide the level of care that they're trained to do, that they want to do. So it's a lot of a sense of being overwhelmed, and a lot of sense of anxiety about just going back.
Premier, how is the virtual care that you're announcing going to relieve any of that anxiety?
It's because the system is so interconnected. So when you have people that don't have access to primary care, that are turning up an emergency room, or waiting to turn up an emergency room until they're sicker and sicker, and so if we can take a certain percentage of the population and get them access to primary care where they can get some early feedback from a qualified healthcare professional, then we can probably remove them from having to interact with the system later, which takes pressure off the emergency room, which takes pressure off the wards, which takes pressure off the system. So everything is part of the solution. There are many parts to the solution. This is just one. When somebody reaches out into the virtual care system, they'll be connected with a primary health care provider like selected doctor, nurse practitioner, other allied, appropriate allied healthcare professional. And from the pilot that's happening now, it's early for the data, but from the pilot, the feedback is very positive. So we that's why we expect that the feedback will be positive overall as we move forward.